Welcome back, everybody. We are now ready for reset number 1, and that is called meatless. We are addressing estrogen dominance with this elimination. So, meatless, we are specifically talking about conventionally raised beef, red meat, and some pork as well. And the reason for this is that with conventionally raised meat, there are on average 6 different hormone types that are injected into the meat. The animals are typically fed genetically modified corn and soy. So you may be doing your best to stick to non-GMO food products, but you are getting genetically modified products in your body through the meat that you are consuming. So this can wreak havoc on your microbiome. It can lead to an increase in leaky gut syndrome, and that can spill out into an increased amount of inflammation in your body in general. Some other issues with conventionally raised meat are the presence of what is called in the book as persistent organic pollutants. And these chemicals can act as xenoestrogens, meaning, it's just a foreign chemical, but it's similar enough in structure to an estrogen that when you consume this, your body then, recognizes it kind of like an estrogen, and it sits on the estrogen receptor in your cells or on your cells. So this can really wreak havoc, and that then, a cell that maybe shouldn't be getting such a large supply of estrogen on that day has whatever your ovaries are making, and then also whatever you are getting from xenoestrogens or, fake estrogens in your body through these toxic chemicals, pollutants in your food, different things that were used in the processing of the meat. And, grain-fed meat also has a poor nutrient density, so it's less rich in your B vitamins, for example. And also its fatty acid profile is suboptimal. So a grass-fed beef is going to have a better proportion of unsaturated fats versus, your grain-fed is going to have less of the good omega-3s, and that can lead to, disruptions in our overall inflammation levels and cardiometabolic risk and all of this. So basically, with this conventionally raised meat, we are just encouraging, more estrogen in our system, either through direct consumption with what's in the meat and or through xenoestrogen consumption. Okay, so let's recap. Your first reset is going to be to eliminate meat from your diet. And the reasons for this are because meat increases estrogen dominance, which is already a problem after 35 for most of us anyways. Also, because of the fatty acid composition in conventionally raised meat, we can be then more prone to storing toxins that are in this meat already. Some of them acting as xenoestrogens in our body, which is then even further worsening the estrogen dominance problem and the subsequent effect on our insulin levels and tendency to store fat. You see how I'm connecting these dots? Yeah, so it's really important to give up the meat. You might say, well, can I do grass-fed? It's 21 days. Just give it up. And then on Thanksgiving or Christmas, you can do what you want to do. So back to that. We don't want to worsen estrogen dominance. We don't want to be consuming toxins that are stored in the saturated fats in the meat. And also we want to be supporting our microbiome And all of these factors contribute to weakening our microbiome and then leaving us more susceptible to increased inflammation and leaky gut. Not to mention when we have estrogen dominance, we just tend to be more bloated, our moods tend to be bad, and we just don't feel good. So really important to get this going. And at about this time, you might be asking, well, what do I eat during this part? Good question. Okay, so here we are, reset number 1, and we're going to focus on what should we be doing for these 3 days. And there's just really 3 rules to go by. 1 is to forgo meat and alcohol. Sorry, I didn't tell you about the alcohol part before, but there is a good reason for it. And that is that alcohol can block some of the activity of the enzymes needed to clear our estrogens that have been used and are, deemed as waste by our body. So, we have estrogen metabolites. They need to be cleared and eliminated from our body. It takes certain enzymes to go through that detoxification process. And alcohol can have kind of inhibitory effect on that. So we're foregoing alcohol just to get our best clearance of those extra built-up estrogens in our system. Okay? All right, good. So second one is we are going to try to increase our fiber by 5 grams or more a day until we get to that goal of 35 to 40 grams of fiber a day. Fiber is going to help you feel full longer and also has really positive effects on your cardiovascular health and blood sugar balance and all of those things. So thirdly is to eat good fats. So we're going to want to focus on our organic extra virgin olive oil, coconut oil, those types of fats. So you might want to consider, like a lean shake or just a healthy meal replacement shake to get you through 1 or 2 of your meals, depending on what your lifestyle allows. But something with the balanced low carbohydrate, healthy fat, and a plant-based protein. So, okay, so I will look a little more at the meatless menu here. And one of the recommendations are, something with eggs in the morning. I'll tell you, one of my favorites is just to roast a bunch of vegetables on the weekend, and you can then use them in a frittata. So you would put them in a pan, mix up, several scrambled eggs, 8 to 10 scrambled eggs, cook that in the pan, finish it off in the oven. You can cut that into wedges, and, you don't have to put milk, you don't have to put cheese. You cut that into wedges, any of the vegetables that you like, red bell pepper, mushrooms, broccoli, a little sweet potato, and then you can take that wedge with you for lunch or eat it, for breakfast in the morning. I love that idea. For lunch, we're recommending, a salad, maybe with some mixed seeds on it, with a fish, some kind of a clean protein. That would be a way to go, or a meal replacement shake is an easy way to go as well. And then for dinner, go ahead and try to have a little salmon, some kind of higher quality fish. You may want to, include just some nice roasted veggies, just as many as possible. Half your plate should be veggies. This is tomato season. Maybe you're going to get some fresh sliced tomatoes in there, and a side of quinoa, healthy grain, something like that. And so try to use your Instapot, try to cook at these things ahead so that you're ready to go, and you'll be sailing through the first 3 days. She does recommend to check in with yourself, and we have a little meditation mantra to say as well. So I have to be honest, I don't, normally do these things as part of a diet plan, but we're here for results. So the mantra is, may I be filled with loving kindness. May I be happy. May I be full of grace. May I be healthy. May I live with ease. So I'll leave you with that, and we will reconvene for reset number 2. Thank you.